Welcome back, everyone. The chance that a man will develop prostate cancer in his lifetime is 1 in 5. If he has health insurance, it's highly likely that the cancer will be diagnosed in its early stages and be curable. But new research suggests that's not the case for men who don't have insurance. Stacey Gleason filed this report.
The new study comes out of UCLA's Johnson Comprehensive Cancer Center. Dr. William Aronson looked at disadvantaged men who were uninsured, the so-called working poor.
We looked at these men, it was about 520 men. We found that at the time that they were diagnosed with prostate cancer, they had much more advanced disease as opposed to men with insurance. Approximately 20% of men in the population that we studied had metastatic disease at the time of diagnosis. Cancer had spread to other parts of their bodies, had spread to their bones. In addition, only 20% of these men that we studied had an early stage curable prostate cancer at the time of diagnosis.
The widespread adoption of prostate cancer screening programs has resulted in more men being diagnosed with early stage disease. But that has not been the case for some minority groups or the uninsured.
Although a number of studies have shown that African American men present with more advanced disease at the time of diagnosis and are more likely to die from prostate cancer, what we have found is when men have equal access to medical care, that differentiation between African American men and Caucasian men largely disappears.
Dr. Aronson says that more comprehensive strategies are needed to improve access to care, along with more screening programs targeted to the working poor. I'm Stacey Gleason for World Health News Today.
If you'd like more information on the story, you can always visit the website www.yourcancertoday.com. Well, a new European study is linking hairspray to a common genital birth defect. Researchers in London say they found a significant link between hairspray and hypospadias, a condition where urinary opening is displaced to the underside of the penis. The study suggests that the two might be linked because of chemicals in the hairspray called phthalates. Previous studies have proposed that phthalates may disrupt hormonal systems in a woman's body that affects reproductive development. Women have a 2 to 3-fold increased risk of having a son with this condition if they're exposed to hairspray in the workplace or around their home in the first trimester of pregnancy. Hypospadias affects about 1 in every 250 boys in the U.S. and also in the U.K. We've been hearing various New Year's resolutions throughout this show, so now we're going to turn it over to our very own Nancy Aziz and Dr. Stan to find out how we can keep those New Year's resolutions, guys.
When you think health, think IRU.